Hi Trevor, how are you?
Fine, how are you doing?
Good, good. And you're the chief therapist here at Omega Clinic?
I sure am.
And down in Los Gatos, California, and been using the GlideTrak for some time now.
Yes, and I really have seen some good results.
Could you tell us a little bit about it so that we could help other therapists understand applications and use and
Sure.
how you feel about the project?
Sure. Well, let's say a doctor sends us a patient and writes toe-touch weight bearing or partial weight bearing. We might call the doctor and see exactly what that means as far as a percentage of their body weight.
Okay.
And we act accordingly, and this GlideTrak works to lift that person's weight off their feet to a certain point, even to toe-touch weight bearing, and allow them to still have the motion, the benefits of their cardio workout, and get the motion going in the joints, get the joints lubricated without violating that weight-bearing precaution, without causing stress to arthritic joints or joints that may have suffered a fracture 3-4 weeks ago. So it gets them off and running long before.
What other kind of equipment would you use to do that before the GlideTrak?
Basically, pool therapy was pretty much the only other avenue. So,
well, you didn't have a pool, so you needed to refer them out.
Correct.
So now you can hold the patients in for a full series of treatments because of the GlideTrak?
We sure can. That's definitely another benefit.
Oh, that's really fantastic. And you feel the clients are being treated really well compared to pool therapy, or how would you compare it?
Well, this allows them to run through a motion, and obviously they don't have the resistance of the water. Whereas pool therapy, they're also unweighted to a point, but they have the resistance of the water, so they can never really run or get a real brisk or intense cardio workout that their body may be accustomed to.
Do you like to use it on many of your patients, or all of them, at some point in their therapy, or?
Probably every knee patient gets this at some point, just to get them up and moving and running and give them an alternative cardio workout.
Okay.
Some of the neck and low back patients may never get this because, of course, they're still getting compression on the neck or lower back because it unweights the body below the seat.
Okay. How about hip patients? Have you tried with those?
Yes, and that works quite well.
You find a good hip extension?
Definitely a wonderful extension moment. If the seat's seated right, if they're seated right, positioned right on the seat, they're going to get a good hip extension.
Oh, Trevor, thank you. Is there any last thing you'd like to say to therapists who might be considering whether this would be a valuable piece of equipment in their settings?
It definitely would be. It's a bit costly, but it certainly pays off, because what we're here for is to benefit the patients in the best and most efficient manner possible, and we feel this machine is helping us to do that even more effectively than before.
Thank you very much, Trevor. It's good to visit with you down here in Omega and see your successes, and we wish you many more.
Likewise.
Thanks.
Have a great day.
You too. Bye-bye.
Bye.